Alright guys, welcome to week 7 and 8 of your ACL recovery. We're going to get into higher intensity strengthening and functional stability, and this is where things really start to ramp up. Today we're going to cover a couple critical areas: strengthening the quads, hamstrings, glutes, and core for better knee control, single leg balance and proprioception, longer walking and endurance-based exercises, a gait analysis and cleaning up any remaining compensations we might have, and then finally knee pain and knee control issues and how to address them. At the end, we'll go through a full week 7 and 8 recovery checklist. By this point, your quad strength should be significantly improving, but if you're only focusing on your quads, then you're missing a major piece of the puzzle. Your core, hamstrings, and glutes are also very important for knee control. If your supporting muscles are weak, your knee control will be deficient, especially as we start doing higher level activities later on. Here are a couple great exercises for strengthening in week 7 and 8. Leg press with a controlled depth, working on even weight distribution. Glute bridges and hamstring curls. These protect your knee by balancing the forces between the front of your leg and the back of your leg, making sure that the back of your leg muscles are nice and strong too. Single leg Romanian deadlifts. These are great for glute and hamstring activation while working on balance. We can continue with sideline leg raises, but functional movements like lateral band walks may be a little bit more effective at this point for targeting your lateral muscles and your glutes. And then we don't want to forget our core either. Working on planks, dead bugs, and pail-off presses ensure that our core is functioning well and that we're functioning holistically as an entire unit. Something a lot of people don't realize is that ACL injuries mess with your body's ability to know where your knee is in space. This is called proprioception, and it's essentially your body figuring out where your joints are in space and the position that they're currently in. Deficits in proprioception might be why you feel wobbly or unstable when you're standing on your surgical leg. If you don't rebuild this now, you're going to have some difficulty when we go back to running and cutting and doing some of those higher intensity exercises. Some movements that can help with your balance and proprioception are single leg balance drills. And this can be as easy as just standing on your leg with your eyes open, with your eyes closed, to standing on a towel on a single leg. So changing the input that our body is receiving by messing with the surface that we're standing on or messing with the visual input that we're providing our body. Dynamic balance drills like standing in place and marching. Dynamic multi-joint exercises like lateral step downs. These will help work on your knee control as you're going through a functional movement that we will do regularly. What we don't want to do is ignore the non-surgical leg, especially with our balance work. We want to make sure that we're doing things on both sides, and also it gives your surgical leg a chance to rest when we work on your non-surgical leg as well. Longer walks, whether it's outside or on the treadmill, make an important step in rebuilding our proper gait mechanics and our endurance for longer activities. Start slow. Walking 1.5 to 2.5 miles an hour is completely fine. Remember your proper walking mechanics. Ensure that your knee is getting straight every time your heel strikes in front of you and that you're able to bend your knee as you go to step forward. Pay attention to how your foot lands, no dragging or compensations. And then you want to increase the duration of your walking before you increase the speed of your walking. So start with a really low amount of time, like 1 to 2 minutes, and gradually increase the amount of time that you're doing it for over time. What we don't want to do is rush the speed. Faster does not mean better, and it often can make us have bad gait mechanics. And then we also want to avoid looking down, and we just want to walk normally, and we just want to keep our head forward just as we were walking normally. If you feel tightness, fatigue, or discomfort, that's completely normal, but if you have any sharp pain that increases as you go, maybe stop and reassess, take a little rest break, and then you can begin again. Many ACL patients don't realize this, but your body is likely still compensating when you're walking, and if you don't correct these movement patterns now, then they can become ingrained and become bad habits later on. They also can lead to bigger issues down the road. Some things to consider: are you limping or shifting your weight away from your surgical leg? Are you able to fully straighten your leg every time your heel strikes in front of you when you go to take a step forward? Are you able to bend your knee enough to swing your leg forward and not have to swing it outward? And is your knee buckling or caving in? If any of these are apparent, it's important that you talk to your physical therapist about how to address them, but some of these drills may help as well. Heel to toe walking, locking your knee out when you go to straighten your leg and your heel strikes the ground in front of you. Hurdle drills or stepping over drills can help improve how much we bend our knee when we go to swing our leg out in front of us, and then it can also help improve our step length. Single leg stance drills help reinforce even weight distribution, and then we always want to strengthen strengthen our glutes and our supporting musculature as well, and make sure that we're not just focusing on our quadricep. At this stage, it's common to feel slight knee discomfort, especially around your kneecap and at the top of your shin. This can be for a couple of different reasons. We could have some residual quad tightness as we start going into deeper ranges of motion. The tendon that pulls on your shin bone to straighten your leg out is now being worked a little extra, and so that tension on that shin bone can be slightly discomforting sometimes, but that's okay. Weak glutes can allow your knee to collapse inward, and that can really stress your knee joint, so you want to address any weak glutes. And then increased movement activity means more demand on the joint, so it's okay if we have a little discomfort, but if we're having reactive swelling or a lot of pain the following days, then maybe we pushed a little too hard in the day before. There are many different ways to address all of these concerns. Here are a few ideas that might help. Strengthening your glutes will help with knee control during functional movements like going up and down the stairs. Foam rolling or a massage or some light stretching of your quadriceps that you might feel over your thigh. And then keep swelling in check and continue to strive for further ranges of motion. What you don't want to do is push through any pain. Slight discomfort is okay and you can get right up against it, but don't try to push through it. You also don't want to stop moving completely. You need to stay active and adjust volume and intensity. If we have a day where we're extremely sore, that's okay. We just need to adjust our volume and intensity so that that doesn't happen the next time. All right, so here's our week 7 and 8 ACL recovery checklist. Strengthen your entire lower body, including your quads, your glutes, your hamstrings, and your core. Single leg balance work and begin rebuilding proprioception and stability. Begin low intensity, longer duration walking and cycling. Maintain proper gait mechanics and fix any compensations now, and fix any compensations before they become bad habits. Manage knee pain and control by adjusting for tightness and adjusting the intensity of your workouts. Lock these in and you're setting yourself up for a solid weeks 9 and 10. So up to this point, what has been your biggest challenge? Drop a comment below, and as always, thanks for checking in. That's it for this week. As always, thanks for watching. Be sure to subscribe if you want to follow along, and I'll plan to see you next time. Thanks.